Globally, the IPCC projects that temperatures will increase between 2 to 6 degrees by the end of this century. More extreme weather events, sea level rise, and changes in major health determinants such as air, water, sanitation, insufficient food and insecure shelter will put at risk the health of millions of people. This threat to global development will also increase the gap between rich and poor. Climate change affects everybody, but some will suffer more than others. In the WHO European region, climate change has already caused deaths and suffering from heat waves, storms, floods, droughts, and changes in infectious disease distribution.
All people, regardless of their income level or place of birth, deserve the same standards of protection from hazards to their health.
In 2008, the World Health Assembly passed a resolution to strengthen health response to climate change. To support this commitment, European Ministries for Health and Environment welcomed the European Framework for Action in 2010. In particular, WHO Europe is assisting its member states in strengthening health services, promoting health in all policies, raising awareness, knowledge, and sharing information.
I would like to welcome the decision that climate change and health will now become a priority in our process.
A unique initiative to pilot health adaptation across 7 countries was started in 2008. Common goals include raising public awareness about climate change, identifying the threats, exploring applications of new technologies, as well as specific training for health professionals on the effects of climate change. Each country is responding with a variety of adaptation actions, from safe water and sanitation to extreme weather events risk management practices. Climate change is compounding historic environmental issues, worsening respiratory diseases in the RLC region. By training health professionals in lung health and developing early warning systems for dust storms are examples of how WHO supports countries such as Uzbekistan and Kazakhstan in preparing and strengthening their health services. Glacier melting is increasing mudslides and flooding in mountainous countries such as Kyrgyzstan and Tajikistan, and heat waves are more prominent in the Mediterranean. WHO helps its member states in planning to alleviate the health risks by developing early warning systems and emergency preparedness tools, as well as promoting community initiatives such as tree planting and green cool places in towns and cities for shade. In Central Asia, not all people and hospitals have access to safe water. District-level water safety plans become essential in those areas. Climate change can also threaten food security and nutrition through altered rainfall patterns. Affected countries, especially in Central Asia, need to better understand the potential consequences and target action. Air quality monitoring in urban areas is essential where high levels of air pollution are worsened by climate change, to reduce respiratory diseases and heat-related mortality. By supporting the modernization of hospitals, such as in Kyrgyzstan and this one in the former Yugoslav Republic of Macedonia, they are being made energy efficient and renewable sources are being introduced, and staff are engaged in tackling climate change whilst improving healthcare. Arctic regions are subject to permafrost thawing due to global warming, causing difficulties in transportation and health service delivery. Basic healthcare resilience is strengthened in remote areas, such as the Nenets Autonomous District in the Northern Russian Federation. Communication and advocacy campaigns are key components of the project, using local media, education and training to raise public awareness of climate change-related health risks. In countries already affected by extreme weather events and outbreaks of diarrheal infections, the project is encouraging citizens to protect themselves and their local environment. In Albania, school children and university students are learning about what positive steps they can take. International support for health adaptation to climate change needs to be increased, as vulnerable populations will face increasing impacts on their health. There is a need to develop and strengthen the health benefits of action on climate change. For example, making it easier for people to walk and cycle instead of using their cars contributes to cleaner air, less noise pollution, and reduced stress, leading to improved physical and mental health as well as safer communities. By working in partnership to link the health benefits to sustainable activities that also respect the environment, we can create a future vision of how climate change can transform our lives for the better.